Conversations about the future and what matters most are key to thriving as we age. One of the best ways to do that is by simply talking openly about what aging really looks like and the support that's available. It's important to start these conversations early and across generations, whether it's discussing daily routines, long-term goals, or support needs. Starting conversations is a sign of respect and a step towards stronger, more connected family. California offers many free resources to empower older adults. Visit aging.ca.gov or call 1-800-510-2020 to learn more. Let's rewrite the story of aging, one conversation at a time, because aging is a journey we all share.
The ABCs of Aging is sponsored by the California Department of Aging. Discover aging resources at aging.ca.gov.
And that's why we're here this evening, to start that conversation. Good evening, everyone. I'm Spencer Christian from ABC 7, and welcome. Thank you, and welcome to the ABCs of Aging Town Hall, Getting Older and Wiser. Now, we have some very important resources to share with you tonight, tell you what's available through the California Department of Aging, which is our partner in this venture. Our program is 1 hour, starting with a panel conversation with the experts we have here on stage, then followed by a question and answer period. So let's start by having the panelists introduce themselves, tell us about the agencies you represent, and the services and programs that are available.
Great. I'll start us off. Spencer, thank you for spending your evening with us, and thank you to our audience in ABC 7. I'm Susan DeMorris. I'm the Director of California's Department of Aging. Through our headquarters in Sacramento, we oversee a network of area agencies on aging, caregiver resource centers, local ombudsman programs, insurance counseling programs, as well as an array of home and community-based services.
Thank you. Good evening. First, thank you, Spencer, ABC 7, the Department of Aging, for hosting and sponsoring this event tonight, and for all of you for coming out, and all of those of you who are online. I have the privilege of serving here locally in San Mateo as your Aging and Disability Services Director, part of the San Mateo County Health Department. I have about 25 years in the field of aging, disability, and older adult mental health, serving as director in Santa Clara County, Marin County, and I got to join this wonderful county early last year, where I work with a fantastic staff committed to providing programs and services to help with quality of life for older adults here in our county. And I'll speak a little bit more later about specific programs and resources for you.
Hi, I'm Kathleen Kelly. I'm Executive Director of Family Caregiver Alliance. We're located in San Francisco, but we serve a regional service area of 6 Bay Area counties, including San Mateo. We are a caregiver support organization, and I'm talking a little bit more about what that means in terms of the services and supports that we have to offer. But we've been around for quite some time, about 40 years. I've been around almost an equal amount of that time. So I've seen the field really grow from not knowing what a caregiver is to actually knowing what a caregiver is, and more I see services and supports across systems of care that support family caregivers and the persons that they care for as well.
Good evening, everyone. I'm Dr. Anna Chodos. I'm a professor at UCSF in geriatrics and internal medicine. I practice clinically at San Francisco General in the outpatient setting, where I work with folks living with dementia, their caregivers, and folks living with geriatrics conditions. And in my academic role, I'm an educator. And I work with practicing clinicians, mostly in our area, but across the state and increasingly nationally, on programs focused on educating our healthcare providers to know more and do better around dementia and other geriatrics conditions.
All right, thank you, panelists, for introducing yourselves and for sharing with us your areas of expertise. I want to start with Susan. It's a question about changing demographics in California, because our aging population here is growing at a greater and greater, faster and faster rate every year, it seems. We may soon become the dominant portion of the state's population. How does California compare with other states in that regard?
So you're right, and that's why I'm so glad to be here tonight and to be joining all of you to be talking about the fastest growing demographic in California and the nation would be the 60-plus population. I turned 60 in April. I'm part of this demographic. It's in my interest and all of our interest to plan for an older population in California. And a lot of credit goes to our governor, Gavin Newsom, who launched California's Master Plan for Aging. When he took office 6.5 years ago, he knew that by the year 2030, 1 in 4 Californians will be 60 or older, 1/4 of our population. And today, the fastest growing population statewide is the 85-plus population. So California's Master Plan for Aging was developed to help us plan and prepare for 2030, and we're taking those steps now. It's a plan for action to build stronger, more resilient communities. You'll hear from our community partners tonight about how they're doing that with the resources that have been made available by the governor and the legislature.
Now, Susan, I want to follow up because I know there's a program called the Master Plan for Aging. Can you tell us about that?
Sure. It started in rooms like this with community members like you who said, this is what's most important to me, this is what I'm worried about, this is what I need to know more about. And there are 5 bold goals that are the blueprint for our state. No surprise, housing is goal number 1. Goal number 2 is focused on healthcare. Healthcare, of course, in hospitals and long-term care settings, but healthcare at home so people can live independently and access resources to stay at home and in the community. The 3rd focus area is inclusion and equity, not isolation. 1 in 4 older Californians lives alone. And we know today that our society is very mobile, families are smaller. We don't have the built-in family supports that generations that preceded us did. So we're seeing more cases of isolation and loneliness. The 4th area is caregiving that works. Caregiving is 2-part. 1, the informal, unpaid family and friend caregivers who provide the vast majority of care in our state and in our nation. And the 2nd part would be the direct care workforce. These are individuals who come into our homes and provide care, as well as people who work in assisted living and skilled nursing communities as well as hospitals. And then the 5th piece, and we took many questions from viewers, is affordability. How can you afford to age in California? And if we see more people living beyond 85 and they're outliving their resources and their savings and their assets and their pensions, how can they afford to age in California?
So now, Lee, I want to ask you about the local impact and how these programs are carried out through the local community partners. What does your agency offer that relates to this master plan?
Well, we're as strong as all of our community partners, the community-based organizations and nonprofits with whom we work here in the county. We work closely with Susan and her office to provide many of the services that she talked about. So help with caregiving. We work with Family Caregiver Alliance for caregiver respite. Home-delivered meals, also known as Meals on Wheels, community center activities so people can get out and stay connected, legal services if someone is looking for legal services and needs help there and can't afford it. My office also looks into situations of older adult abuse and neglect. So if you've got a friend, neighbor, family member you're concerned about, our office can help with that. We unfortunately get a lot of calls for financial abuse and financial frauds and scams, and so just please be careful of all of those. And I want to touch on the social isolation. It's also a very important part of healthy living, and the wise thing is to stay connected with people, whether it's your next door neighbor, your church, or wherever. The county, as you may recall, last year at the beginning of the year in January, we're the first in the country to declare loneliness a public health matter. And starting this month, we are going to be launching a project looking at what other what services and connections are available for older adults and adults with disabilities, what we need to have a place where everybody can thrive, and then those recommendations are going to go to our Board of Supervisors. Just a couple of other points that Susan touched on, the 25% right now in San Mateo County, 25% of our population is 60 plus, and Susan, I will join you in September as a 60 plus, so. I tell you.
Guys are youngsters. Next month I'll be 78. Catch up with me. So, Kathleen, I know that caregiving is a hugely important issue to the aging population, and you're involved with the Family Caregiver Alliance. Can you tell us what services are offered there?
We started, as I mentioned, decades ago, and we have the great pleasure of also having a federal program that's administered through the Area Agencies on Aging and the Older Americans Act called the National Family Caregiver Support Program. So there are similarities in both of these services, because they're pretty much the gold standard of what people need. And first, we start off with an assessment to really understand what's going on with the family, what's going on with the caregiver, what are the issues that they're facing in terms of their actual care responsibilities with their relative or friend. And then we do work to address those kinds of needs through education and training, and we have a lot of resources for, in terms of consumer content in all different kinds of formats. YouTube video, we have a YouTube channel. You can go and watch videos on direct care assistance. We have over 400 articles about all aspects of care and covering a wide variety of topics that are mostly suggested that come through you, the caregiver, and are filtered through our staff, of course. So we have many, many written materials on planning, on legal financial issues, and so on. So we do counseling. We also do legal and financial planning. That's a big issue. To make sure that you have all of your advance directives, but also how do you really go about setting up a trust, all those kinds of things we can provide some advice and counsel on, and referrals to attorneys. We operate support groups, wide variety of support groups on different topics serving different audiences. And we also have respite services, which are really vouchered services to allow the family to purchase a type of service that best fits their needs and cultural experience, so they can get a break from caregiving. We are strong believers that everyone needs a break. So we have respite opportunities as well. So we do all these different types of services and programs out in the community. If you know people who are in other parts of the state, there's a website that talks about where all the other caregiver resource centers are located in the state, and you can also come and visit our website at caregiver.org. It has a wealth of information there. I would suggest that you might want to take a look at the education programs. We do a collaborative calendar across the Caregiver Resource Centers, which means that anybody from anywhere can sign up for these classes, and there's 30 of them typically a month, multiple languages sometimes, variety of different topics, so you can get educated about the topics that are most near and dear and you feel like you really need to have a webinar on that topic. So they're free of charge. These services are free of charge. And I invite you to take a look at the website and also give a call to our office or go in through CareNav, which is our digital application process.
And Dr. Chodos, thank you for waiting so patiently for your question. There'll be others, of course. But geriatric and dementia care are critically important to the aging population. And I know you're associated with Dementia Care Aware. Can you tell us what that is?
Yes, absolutely. Thank you for the opportunity to say something about that. So I mentioned to everybody that I spend a lot of my time working with practicing healthcare teams, so primary care providers, their teams in clinics that you might be going to help educate them, empower them, and give them the tools to do better care around dementia. And we really advocate a screening approach. So the Dementia CareWare program was actually initially started by Medi-Cal, and now we're working with other partners, including a foundation here in California, West Health, to get the word out and to get training out. So I hope that when you go to the doctor, you get some assessment for your cognitive health, or if you have a concern, that it's addressed. Really, we emphasize that the key components are to get some information about how that person's cognition is doing. So are they having any symptoms? And is there a brief test that you could do to see how they're doing? How are they doing? We say functionally, but really it's about whether or not you're needing any help that you didn't used to need around day-to-day activities, like getting to the grocery store, getting through a shopping trip, doing laundry, things like that. And then the last thing we really advocate for, and it's to tie in with my colleagues here, does that person have someone in their life that is a caregiver, that is providing any assistance, and how can we support that caregiver as well as the person themselves? So many of us will have caregiving or receive caregiving at some point, and turns out it's really, really important for our own health if that caregiver is supported as well. So we do a lot of connecting to the Department of Aging and Family Caregiver Alliance.
You know, everyone who has spoken so far has touched at some point on caregiving, which is so important. In fact, you could see that the C in the ABCs largely stands for caregiving. And I think caregivers are often, I don't want to say overlooked, but when we talk about the overall challenges facing the aging population, we don't usually start with caregiving. So since you've all talked a little bit about it, if there's anything you'd like to touch on before we go to the audience questions, I'd love to hear it. Because caregiving can take a really strong emotional toll on the caregiver.
I'll say something after you address that. I think you can probably address Kathleen better that.
Well, caregiving takes two tolls. It takes a financial toll. Caregiving is expensive. I mean, if you're ever looking for services and you're not qualified or eligible for services through Medi-Cal or the veterans, or you might have a long-term care policy, paying for those services out of pocket is really, really pricey. We don't, at our program, we do not have an income restriction. In other words, anybody from any income can call Family Caregiver Alliance. And what I would say is that most of our clients are, what is now termed the missing middle. That's, you make too much money, income per year to qualify for Medi-Cal, but you don't make enough money to pay for services privately. I call this the majority missing middle, actually, because that's pretty much who we see. And so caregiving really is a very expensive proposition. And it's one that we do need to address in the future. And there's been a lot of studies around how can we start a insurance program, social insurance program in California. It's not here yet, but we really do need to address this financial toll. The second way it's financially taking a toll is that when care gets very intense and personal, oftentimes people need to leave the workforce in order to care for their relative. And so that's a secondary toll, not only in the loss of things like Social Security, accrual benefits, and wages, obviously, health care possibly, but it also means that, going back into the workforce might be a bit more of a struggle because you have now missed out on your networking and upgrade of skills and those types of things. So it takes a toll directly in terms of paying for care, which can be quite expensive, and it also takes a toll if you need to leave the workforce in order to provide that care as it becomes more intensive and personal.
So my office is what's known as an area agency on aging, and we are charged with identifying what's important to older adults in our community, so planning for those needs, administering funding for a variety of the programs that I mentioned that go to our nonprofit partners. And the other thing is we are charged with collaborating and advocating. So I'm going to right away start talking and ask you to advocate more on this issue, or really any issues that you think are important to you. I think when it comes comes to caregiving, yes, everything that's just been said, but we need to change our mindset in our society, in our country. We need to see caregiving as a valuable resource, a valuable job. We need to not dismiss and diminish it, and we need to not pay it so little. Clearly, we have a strong need in our families and in our communities for caregiving. It needs to be respected more, and it needs to be paid better. I wanted to add, while I'm talking about the community partners and networks, for those of you who are in the audience, in your tote bag, you got a booklet called Help at Home. It's produced by our Commission on Aging. Our Commission on Aging is our advisory body, and they advise my office, they advise the Board of Supervisors on matters of importance, and they produce this booklet every 2 years. So lots and lots of resources in there. And I think for the audience online, you may be getting it, but let me just say the website. It's SMC for San Mateo County, smchealth.org/help at home. Thank you, Spencer.
Is my microphone? Okay, there we go. It has been said that the best long-term care policy you can have is an adult daughter, and that's because statistically, the average family caregiver is a 47-year-old adult daughter. But I want to commend our community partners at this table and other nonprofits and community-based organizations, because that is no longer true, and it's certainly not true in California. We see people of all ages. There's a trend that young adults, especially in communities of color, are serving in a caregiving role, possibly foregoing education and employment opportunities to serve in that role. And our department just led the state's first ever LGBTQIA+ survey, where we heard from over 4,000 older adults in our state. And many, one of the big concerns that was raised by the LGBTQ community is not having children, older adults today not having children, and not having a network of family members nearby or even in California. And so we're seeing more childless families as well. So it's something that we really need to shore up our support for the family and friend caregivers that are helping today, but we also need other strategies as well, because that's not an option for everyone.
So yeah, I wanted to add something just to encourage everybody that it's really okay if you are a caregiver, if you have a caregiver that you want involved in your healthcare, to advocate for that. So we are catching up with the need in healthcare. And what I mean by that is I have another educational program where we train healthcare on how to identify, engage, and ultimately, hopefully, support caregivers well. And by doing so, of course, supporting the person they're caring for. But like I said, we're catching up. So often a visit will happen and a lot of stuff will get thrown on the caregiver, a lot of assumptions will be made. So starting off a visit, introducing yourself or introducing your caregiver, saying how you want them involved, and helping that clinician or that primary care team to help you identify what the needs are. And that's also very true in the hospital or skilled nursing as people are going through transitions. So it's okay to be an advocate. It's actually really helpful and appreciated, and just want to encourage people to help us help you.
On that for just a moment, and that is, we have, because we know so many caregivers go with their relative or friend to doctor's visits, and they're at the hospital, they're in the emergency room, and so on, that we developed materials around how to better communicate with healthcare professionals. And sometimes it's just making your voice heard, and concomitantly, I know that my colleague is working to, better recognize families when they come in and ask, are you involved in the care, and to involve them as part of the care team. And this is one of the big development efforts that's going on within healthcare, and there's been many, many different touch points where healthcare has started to emerge through the guide model, through special caregiver codes and that you bill for within the health systems, through the DSNP, dementia, and in the Advantage plans, and so on. So policy is moving in that direction. We're just the most early adopters, I think, really were at UCSF in this regard.
So we said we wanted this to be a conversation, and that includes the audience as well. So are there any questions? Anyone have a question? Yes.
I have one, and I hate to bring it up, but if that bill gets passed in Washington, how will that affect your operations, and will you be able to do what you're doing now?
Well, thank you for bringing it up. It's been on my mind quite a bit the last few months. We've gone through quite a roller coaster in the world of aging since January and February. I happened to be in Washington, D.C. for policy work with our members of Congress at the end of March when things were looking very grim. Our administration at the federal level was broken apart, split into 3 different agencies within the Department of Health and Human Services. Our programs, many of them, ones around adult protection and protection in nursing homes and so forth, were put up for no funding. So it hasn't looked good. I'm not even talking about the Medicaid part of things. So that has not looked good. But I remember I said advocate just a moment ago. We have worked very hard the last several weeks, the last 2 months, and we got good news on Friday that pretty much everything, with some minor exceptions, are going to remain steady for most of the community-based programs that we operate. Again, caregiving, meals, community centers, and so forth. The Medicaid is still out there, yet to be known what effect that's going to have on folks.
I'm sure there must be other questions. And yes, I feel like Phil Donahue running through the audience here.
Okay, thanks. Good evening. I've been a long-term care ombudsman for about 15 years. And so my constituency, before coming here this evening, I took sort of a random poll at 3 facilities that I visit. And what was on folks, and I said, I'll be your spokesperson, and their concern was around the missing middle issue. So many are in the larger facilities are having to deal with rent cost increases of 10% a year, care costs of 15 plus a year. And these folks are they truly are running out of money. And the supply of the small 6-bed facilities is decreasing. And those used to be that's where folks used to go if they couldn't afford the larger facilities. And or also the supply of facilities in Stockton, in the Valley, where folks would go as an alternative, that doesn't seem to be growing much either. So there is something called, I know, the assisted living waiver, and beds have been expanded through that, through the master plan, I know. But I'm just wondering, is there anything, and then year after year you go to the legislature and you try to lobby, and it's not the consumers that have the power to lobby. And we try to do what we can, but the money is sort of stacked against us. So in terms of regulation, particularly regulation of rates and whatever, those bills just kind of disappear. So I'm wondering, is there anything specific being done to help this population in San Mateo County? And I guess Lee and Susan, there's probably a question as to both of you. What do you see happening to these folks that are being priced out of where they're living?
Sure. Well, first, thank you very much for being a long-term care ombudsman, and for the audience, let me explain what that is. It's a very, very noble cause. The office, your local office, Area Agency on Aging and Disability Services, we are contracted with Susan's office. We get money from the Department of Aging, and then our funding goes to a local nonprofit to provide basically advocacy, education, and support for people living in long-term care. So our ombudspersons are there to listen to people, the residents who are there, and to be their advocates should things not be going the way that they need them to go when they're living in long-term care. So a beautiful thing, and thank you for volunteering to do it. You know, the assisted living waiver, for those who may not know, it's a Medi-Cal program, federally a Medicaid program, where if people are qualifying for Medicaid, they can live in a board and care instead of having to go to skilled nursing, or worse, just stay at home and not have the help that they need. When I was in the previous county in Marin a couple of years ago, I worked for 2 or 3 years to try to get some slots, as they're called there, and wasn't successful. So again, kind of back to the advocacy. I'm not aware that we're going to be getting anytime soon, given the state budget. We need 2 things. We need the funding from the state budget, and second, we need board and care facilities willing to take that lower rate. But absolutely housing, and we need to think of this kind of housing when we talk about housing. It's not just apartment buildings for seniors, it's this type of housing. And I know that's why we have it as one of the planks in the master plan for aging.
Perfectly. That's exactly right, that housing is goal number 1. It's not just a home with a picket fence. It's all types of housing, which includes nursing homes. We have a shrinking number of nursing homes and bed capacity in our state. We have a growth in the assisted living sector, so there are more options. But as you note, especially for the affordable options, very few and far between. I'll point to one of the programs that the governor and the legislature approved. It's called Community Care Expansion, where hundreds of millions of dollars were invested in board and care homes to keep them operational, to keep them viable. So that's money that flowed directly to some of the 6-bed and smaller residential care facilities for the elderly. I don't know the numbers for San Mateo County, but throughout the Bay Area, a number of communities were invested in.
If I could just add, when you're talking about going to the legislature, you may not have a lot of dollars, but look at this room. My guess is there's a pretty high voter rate in this room, so just remind people of that. Yeah, so.
And we meet legislators all the time that have family members, older family members that are living in assisted living and skilled nursing, and they talk to us about the high cost and how they're spending down their assets. So increasingly, it's an issue that's facing our legislature and our governor as well.
And we have another question here.
Yes, the need of the elderly are so huge, and a lot of service are provided, but how do you go about looking for them? I mean, they're so divided. It's not concentrated at one location that you can go and find out what you need, where you get help.
Well, that book that I put in your tote bag called Help at Home is going to be a great resource for you. It is intended for our local audience here to be able to get those resources. I think I think looking for information and resources is something we never think about until we need it, and then we don't know where to start. So it's good that you're coming here. It's good that you're finding out information. There's all kinds of numbers in there. We also operate a local aging and disability resource connection. I have a phone number I won't give now just for time. But that will be a good place. That will be a good place to start, and it's got lots of valuable numbers in there for you. And share it with your friends.
That tote bag to which Lee referred, it will be given to each audience member as you're leaving. So you'll so you don't have it now, but yeah, you'll get that as you're leaving.
It's under your seat. It's under your seat. No, I'm just kidding.
Okay. I think it can be very delicate for some people to have a conversation about caregiving with a loved one or a family member, and many people, even people who are talkative like me, find it difficult to start that conversation, even though this is all about starting a conversation. What advice do you have to someone who has an aging family member who will at some point need care beyond what they've normally get from the family that visits occasionally?
I get this one. It looks like no. It's a really wonderful question. It's a tough issue. It can be obviously feel really sensitive, really difficult. I face it all the time. In fact, talking with folks about needs that I'm observing that I can help perhaps connect to a resource. Somebody, you may be a family member or you may be a clinician trying to have that same conversation. I think particularly, and we had some questions that were submitted ahead of time that touched on this, particularly around issues of brain thinking changes, cognitive changes. Maybe you're concerned about dementia, maybe you're concerned about driving. I think it all kind of starts in the same place of you do know that person best, how they might react. I think coming at it from a supportive, open-ended, empathetic, like imagine yourself in their shoes, trying to have somebody come look you in the eyes and have that conversation. So prepare and really be compassionate. I think the other thing that sometimes can be really helpful when you start to broach this topic, I've noticed these things, how can I help, is coming armed with some resources. So probably one of the biggest challenges if we come with a concern and we don't really, maybe we do want to figure out a solution together, but particularly around driving, like do we have any solutions for suggesting that we've stopped driving? Is there a community resource for transportation? Now many health plans will pay for transportation, at least to medical appointments, but starting to get a patchwork of solutions together so that people don't feel like you're just taking things away. I think sometimes that is one of the challenges, particularly around cognitive concerns, when we start to talk to people about, we're noticing these things, it's having this impact, how can we change the trajectory? How can we be more helpful? How can we bring support? And also make sure that you're going to be healthy throughout this and that you're not going to have any unnecessary consequences like accidents or medical events because you're not getting the support you need. So when we start to have that conversation, realizing what is the goal? The goal is often to bring support to the situation, not to, if you will, ensure that they understand, the issue always. So often people with cognitive concerns won't know that they're having those symptoms and they won't be able to know. Not everybody, but some people really will be, it's part of the condition of dementia that they may not actually ultimately be able to understand that this is what's going on. So focus on how can we bring more support and resources for whatever the actual challenges are, more than just simply ensuring that the person understands and is, walking the same path that you want them to walk. It's more about solution-oriented than necessarily, ensuring that they understand. There's lots of concerns, of course, about ensuring that person's independence, autonomy, involvement in their own care always, but suggesting a solution or bringing a resource like, now you're coming over twice a week to help ensure that some of the household needs are met. That may or may not ever really, that may be a great solution without really addressing, the problem head on, if that's not been a realistic solution. I hope that was a little bit helpful. But I would say just prepare and think about it and be really empathetic and stepwise, just offer things and keep trying. Try until you get a solution as well. I think we do a lot of trying and failing and trying again.
One thing that we've noticed is that there's a big uptake of calls into our office after major holidays like Thanksgiving and Christmas, when the kids go home and they realize, wow, I think my parents or parent needs a little bit more help, and there's definitely an uptick. And we get calls that ask exactly these questions. I've noticed something's going on, what can I do about it? And so we do have staff who kind of talk through some of the options, but we also have, again, a lot of materials about holding family meetings. How do I ask for help? How do we really talk about, needing a different type or different level of care with my family? So you can find the information out. These are really not the most comfortable of conversations to have, but they definitely are meaningful conversations, and planning makes you feel a little bit more in control.
I know you have your hand up. Can you stand up? Do you mind? Okay.
Hi, good evening. Thank you so much for being here. My name is Virginia Kroger, and I'm representing Self-Help for the Elderly and High Cap of San Mateo County. And I just want to commend the woman that asked about where do I go to get help? I think one of the things that we recommend, being with self-help, having encompassed so many areas of care for the elderly, is to go to someone that you trust, whether it's a community center, your senior center, your practitioner, even clergy, anyone that you trust. They are a great resource. They have, they'll have things in the Help at Home book. They'll have contacts that can refer you. I think it is a little intimidating, especially when you need the help. You have to jump over that fear of asking for it. But if you go to someone that you trust, even if it's a community center, you go there weekly to play a game or have a coffee time with someone, I think that gets you over that fear. And at Self-Help, we do that as well. And High Cap, we counsel on Medicare. There's nothing pretty much bigger than Medicare right now. So we really appreciate your time and all of your efforts here, and just want to encourage anyone who has that question, go somewhere that you trust. Thank you.
Yeah. I see another hand here. Yes.
So during the COVID days,
Yes.
the wrong place to be was nursing homes or assisted living, because the death rate was very high and the quality of care to manage COVID wasn't there. To a recent incident here in San Mateo County, where a resident was given bleach to drink instead of orange juice. I'm sure you know about it, Lee. So what has been done at the county level and the state level to improve care for the residents so that they are taken care of and within the guidelines established for them?
I want to make sure that I understand the question. Is the question about what are we doing to improve care in the assisted living facilities and nursing homes?
5 years ago, we had COVID, and what has been done over the last 5 years to help improve care for the residents?
I'm going to let Susan.
Okay. We've got about 1,200 nursing homes and about 7,800 board and care or assisted living communities throughout the state. And they're varying sizes. We have for-profit and nonprofit, large and small. So I want to thank you, sir, for being a volunteer ombudsman. So that is one way that we're eyes and ears in the community, and that's something that we were seriously lacking during the COVID pandemic, when family members could not visit and ombudsmen were not allowed into the communities. We also stood up a working group to consider if family members could be essential caregivers in a future public health emergency, and legislation was introduced, and that's been contemplated if there could be concessions or considerations in the future, because we know how difficult that was for everyone, for the resident, for the family, for the staff, and that family members provide so much additional care, even with paid staff, with meals and support. Does that get it? At the question, there's also been increased nursing home rates. Assisted living is a private pay model with the exception of the assisted living waiver. So most people are paying out of pocket privately, and it's a market-driven environment where there are fewer government interventions. But we did just pass in the past year a whole new suite of regulations for dementia to really focus, to assume every resident has dementia, and instead of singling things out, to build communities that support anyone living with dementia or Alzheimer's, instead of requiring people to live in specialized facilities. Everyone should have the training, and all facilities should be equipped.
Anything at the county level we have done? to help improve service?
The Office of the Long-Term Care Ombudsman is the place where that is where we're looking at getting the information to see what protections are in place, and as you know, that's very much focused on the individual. When we start talking about the facilities overall, it does become more of, I'm not trying to push it off because remember I'm a pro advocate, so but it does become more of a state matter. It's the Department of Public Health, for instance, in skilled nursing facilities. Again, I think and it's very much that these residences, I want to say residences because I don't want us to think that people who are living in a board and care or skilled nursing home are not members of our community. They are. They're just not living in their own home or apartment. But much of the regulations are federal, and there was a question at the very beginning about concerns at the federal level. There are some proposals to reduce some of those regulations and requirements that are very concerning to me, so we will be letting that be known. So again, I come back to, I really think, our representatives here in San Mateo, Liccardo, and Mullen will be very receptive to hearing. I've met with them and found them to be very interested in these issues for older adults and adults with disabilities, so I encourage that angle as well. Thank you.
Okay, I just have a question, because you mentioned housing. And most people fall in the pit where they can afford assisted living or they don't qualify for. But what about helping people who can age at home?
So that it really depends on, people who own their homes outright are better equipped to age in place at home. People that no longer have a mortgage or a rent payment, we're seeing that the fastest growing homeless demographic in California is people age 50 or older. Most of them are renters, so we're very concerned about people being able to retain housing. As far as being able to age in place and remain at home, our partners here and around the Bay Area and around the state have a whole array, if you want to talk about some of the programs and services we offer to help people live independently.
Yeah, absolutely. And it's, of course, going to, as most things in our life, it's going to depend on one's economics, as Susan is mentioning, whether you own your home, whether you rent. Of course, it's going to affect your ability to afford aging and afford being able to stay at home. There are quite a few services in the community, and I will just say, I haven't said yet, but all of the ones I've talked about tonight are they're not income-based. They're open to everyone, and that's what I think is the beauty of an area agency on aging. As a part of our Federal Older Americans Act and our funding, you're 60 plus and you need caregiver respite from Kathleen, you want to come to a community center and have a meal, that is there's no charge. There's no charge for that. So I encourage, kind of back to this isolation and loneliness, is for people to stay connected and involved. So aging at home, I don't think is just staying at home and waiting, having a caregiver come in. You're not going to age very well if you do that. So let's say you do have that caregiver, and sort of to what was being said earlier, when we have to have those conversations about someone needing a caregiver, think of what is important to that person, what is positive for that person. Maybe it's going out and seeing friends every couple of weeks for lunch, and the caregiver is going to help you be able to stay fit to be able to do that. But for instance, our office, we have assistance with transportation if someone needs help in that area. We have done falls prevention to come and look at your home, so I would encourage everybody to do that if you can. Have I got the rugs removed? Is my stair railing rickety, and so forth, and to assess whether your home environment is going to be a place to be safe.
Just a quick tip about aging in place. I think we heard, how important it is to prevent falls. That's often a reason, it'll sort of be picked up that the environment wasn't particularly suited for that person and unsafe, if you will. We definitely, there's things like home health referrals with PT, OT, which can help identify areas that are needed for modification or exercise. So we often will connect people to that, as well as free home modification programs. We have one in San Francisco County. But the other thing is on the falls side, preventing falls, which is a major, major issue, is the strength and balance component of it, which is some exercise. Tai Chi actually has the best evidence for fall prevention. And then the other piece is bone health. So if you have osteoporosis, and any sex or gender can have osteoporosis, so talking to your doctor about your risk factors and if you've been screened. So those are the two sides of the coin that we really address with fall prevention. So just wanted to put a plug in for that.
We have some online questions I want to squeeze in here as well, and some really good ones. Here's one, seeking advice on how to manage the transition from working to being retired. I would say just don't retire, but
In a plug, there are many volunteer programs. We have health insurance counseling, long-term care ombudsman, and many more people who answer phones in our agencies. We're here in a beautiful San Mateo Public Library that needs volunteers. So I think a great way to stay connected with the community, we need intergenerational programs. You can help in schools, help teach kids how to read. So I would encourage a lot of people as they retire, take on a lot of volunteer commitments immediately. You might start with a few hours a week, see how that goes. But you'll meet new people and it continues with purpose and meaning.
by the way, that question was from Michael Holler of San Mateo. I forgot to mention his name. Did you want to add to that? Sure.
That's an absolutely great suggestion. Start thinking about what you want to do long before you do retire, because everything I have seen, the people who don't do so well in retirement just retired and thought it was going to be a vacation, and 6 months later they're completely lost in life. So.
And I was going to add that this, in some ways, you could think of it as like a general framework as well for healthy aging overall, so that it is a really, really big transition for a lot of people to lose that routine. But generally speaking, there's sort of three buckets, and one would be physical health. You know, what plan do you have to maintain physical health or improve physical health? You know, just something that you enjoy doing and want to do relatively often for physical fitness. The other would be mental stimulation, and there's kind of two pieces here, particularly around the retirement issue. One would be really identifying, connecting with, even growing what you see as your purpose in life. So it's been shown that having a purpose and continuing to contribute to what you feel like is your purpose in life does correlate with healthy aging. But the other would be just cognitive stimulation. We know is really, really important for good brain aging, brain health as we get older. So just anything that you do that sort of challenges you a little bit. It doesn't have to be the New York Times crossword or the Sudoku puzzle in this place, but something that you enjoy doing and pushes your cognitive abilities a little bit. And then the other is just the planning piece. So maybe that's a good time so all my colleagues here have talked a lot about how to just plan for the future, start to address some of the advanced care planning, just the nuts and bolts, like even the boring stuff. It's almost like, now we got to do our taxes, now we got to do some advanced care planning, designating surrogates, identifying resources that you have and that may come in handy if you're looking for caregiving or other living options, and just planning sort of that sort of aspect of life.
And having that sense of purpose is so important at all ages, but especially as we age. Vicky Molinares from Hayward asks, how do we travel by ourselves when we get older? What are some good bits of advice on traveling alone as you age?
That stumped me.
Make use of other people on the plane. Look around and get them to put your bag up for once.
Do you want to travel alone? If because there are many groups that you can go with, from Rhodes Scholar if you want to sort of do the intellectual path and learn as you travel. Of course, there are others where you're just going to see a place and you're going on a tour because maybe the language in the country is not one that you speak. I personally have not really traveled alone, so I don't think I would be so good, other than having someone help me with my bag in the airplane. Suggestion.
I think we heard the term stepwise. I think with anything, start by going overnight somewhere nearby and then go for 2 nights somewhere a little further. I think anything radical, starting, never traveling alone and spending a month abroad might be a big leap, but start small, build confidence.
There are a lot of new tour companies and opportunities to go on cruises, and they gear themselves to single people. It's gotten very popular.
That's great.
Let me repeat the question for those who are watching this by way of live stream, and it was about traveling alone becoming more popular.
Yes, it's gotten. I see advertising all the time lately.
Right.
That they are popularizing the idea of traveling alone.
Popularizing the idea of traveling alone. Yep.
Alone. Maybe by yourself, but
Right.
you're meeting other people
Right.
on a
Exactly.
cruise or a tour or what have you.
Exactly.
That must be the idea.
I want to get back just very briefly to something Dr. Chodos touched on earlier about driving. You know, when you may suggest to that loved one that maybe they need to stop. I mean, that's something that I think about now, because I'm beginning to sense that my vision is declining a bit, and at some point, you know, it may not be safe for me to drive, and I can imagine feeling that I'm being robbed of my autonomy, my independence, if that happens. And I'm sure many other aging people feel that way.
I'll just say, I know Kathy mentioned there are really, really great resources about, one, evaluating maybe your own abilities and if there's some sort of transition point for you, but also if you want to have the conversation. So caregiver.org and Alzheimer's Association also has some great resources on having this conversation. I know the DMV will do repeat exams, for example, and then sometimes clinicians or physicians can be helpful to do some amount of assessment on sort of physical ability around driving. Again, something I think, Kathy, you said about planning really is power in these situations. So planning, you know, what would be some things that would make, you know, me not want to drive anymore or not feel comfortable, but if I don't have a plan, I'm not going to know what to do instead of getting in the car and going about my day. So planning for what an alternative might be and doing that enough in advance that you feel comfortable about it and you have a plan.
One of many adjustments we have to make as we age that may make us feel like we're losing our independence and autonomy, but having those sensitive, caring, loving conversations about it may be helpful. Marna Fontaine from San Bruno wants to know, what's the difference between brain fog and early dementia?
Yes. So brain fog, I wouldn't say is necessarily a well-described clinical syndrome. What I will say is dementia is a bucket term, so it's just a general term, almost like heart disease, kidney disease. It doesn't say what's causing the symptoms. It's just saying that you're having symptoms of cognitive decline to the point where you're needing some functional assistance, some help from somebody else for some activities. Of course, if we catch it really early, you may not be having those functional symptoms yet. And brain fog, sometimes difficulty concentrating, difficulty paying attention, feeling like you can't remember things, feeling like you can't attend to information, all of those things could be early symptoms. So the brain does a lot of things, thank goodness, but it does make it a little harder to sometimes diagnose, particularly early on, if people are having really meaningful symptoms, because some people have language changes. Some people have more mood and behavior changes as a first symptom. Some people really do notice the memory, and some people notice brain fog or trouble concentrating, which is how I'm going to interpret that term. I will say there's so much we can do. If we mentioned Dementia Care Aware, it's dementiacareaware.org, and it's mostly geared towards clinicians, but we have a lot of information about what we call the Brain Health Plan, and it really helps with symptoms, and it helps slow progression if you do have dementia. And the main factors are just making sure you can hear and see. These are incredibly potent factors in our brains getting good information and feeling calm and collected, if you will. It puts a lot of stress on our brain to not be able to hear and see. So we really recommend addressing hearing and vision. That can help actually with brain fog. The other is medications. So I just want to really emphasize a lot of us are on medications that actually impair thinking or reduce cognitive abilities. So bringing this up with our physician and asking them to review our medications for any difficulty there. And then social and physical activity is another really, really big one that keeps those activities, keep the brain stimulated, keep it more engaged, and keep it out of the fog, so to speak.
I hate to interrupt at this point, but we are really running out of time now. So if we did not get your question in tonight, please go to our event page on abc7news.com. You submit your questions there, and we'll get an expert to answer it for you. And thank you so much to our panelists. Susan DeMorris, Lee Pullen, Kathleen Kelly, Dr. Anna Chodos. Thanks to the San Mateo Public Library for letting us use this space. Thank you for coming out in person and joining us. And thank you to the audience at home watching us in our live stream. I should mention that the parking garage closes at 8, right? So if anyone parked in that garage, you might want to get out of there before 8 o'clock. Thank you so much for joining us, and have a good night. Fraud is something that can affect anyone, but Californians 60 and older often have more to lose, so it's important to know what scams are out there. Be careful of grandparent scams, where someone calls you and says your grandchild is in trouble and needs money immediately. Contact your family to double check. Don't give out personal or financial information unless you know the person or the entity is legitimate. And watch for tech support scams, when someone says your computer has a virus, but they can help save your data for a fee. If anything sounds too good to be true, it probably is. But older Californians don't have to deal with this alone. There are resources available to help prevent and handle fraud. Visit aging.ca.gov or call 1-800-510-2020 to learn more. Remember, knowledge is power.
The ABCs of Aging is sponsored by the California Department of Aging.